Good evening. Welcome to tonight's video chat where we'll be discussing updates on the COVID-19 vaccine in the pediatric population. My name is Becky Johnson-Rascola. I serve as the Vice President of Education and Community Engagement for the Crohn's and Colitis Foundation. Tonight's program, as I mentioned, will be focusing on questions and updates around the COVID-19 vaccine and specifically in the pediatric population. And we hope to address some common concerns for our IBD patients and their caregivers. Our featured guest tonight is Dr. Namita Singh, who's a pediatric gastroenterologist and the Associate Director of the IBD South Clinic at Seattle Children's Hospital in Washington. Dr. Singh, thank you so much for joining us tonight.
Thank you so much for having me here today. I'm really excited to be here and to share with you some knowledge about COVID-19 vaccinations in our IBD patients.
Great. Thanks again for being with us tonight. As a reminder, the information we are sharing tonight during the chat is meant for educational purposes only. It should not replace any advice you receive from your child's healthcare team, and we encourage you to direct questions to your child's healthcare provider after tonight's call. If you have other questions regarding Crohn's disease or ulcerative colitis, we may not be able to get to them during tonight's chat, but please contact the IBD Help Center at info@crohnscolitisfoundation.org or by calling 888-MY-GUT-PAIN with any questions you may have. We have staff there waiting to help you. Lastly, if you are watching, please be sure to comment and let us know who you are and where you're joining us from tonight. And now with all of that out of the way, we'd like to jump in and get started with our questions. Dr. Singh, the FDA and CDC have recently announced the authorization of the Pfizer-BioNTech vaccine for children ages 12 to 15. Has this vaccine been found to be safe for children?
So that's a great question. So currently the COVID-19 vaccine that's produced by Pfizer is the only one that was granted an EUA, so it's emergency use authorization, and that approves its use in pediatric population. Remember, this vaccine has been approved for the use in adolescents age 16 and older since December 11th, 2020. However, in this younger age range with children of ages 12 to 15, this has been tested in trials in over 2,200 children. And just last week on May 10th, it was authorized for use in that age group. This is quite exciting because it really broadens the age group and really addresses a lot of some of our patient population. And it is important to know that in the trials, this vaccine was both well tolerated and actually 100% effective at preventing COVID-19 infection. In the group study, there were no cases of COVID-19 in patients who received the vaccine versus 18 cases in the group that received placebo or no vaccine. So yes, it has been studied thoroughly and it does seem to be quite safe and effective.
Great. Does it seem that the side effects are similar to what we've seen in adult patients who have received the vaccine?
Yeah, so the side effects were mostly mild and similar to what we see in adults, and they seem to resolve between 1 and 3 days. So the most common is pain at the injection site, and about 9 out of 10 pediatric patients reported some type of symptom, whether it was arm pain at the injection site, as you sometimes have after vaccinations. Some patients also did report some fevers, feeling fatigued, headaches, and muscle pains. And these were commonly seen after the second dose versus the first dose. It is important to recognize, though, that these side effects that make us feel a little bit crummy for a day or so are actually good signs that we're mounting an immune response, and they indicate that our immune system is really working and strong.
That's great. That's great to hear. Is there anything that would be unique to IBD patients, or again, should they expect similar side effects?
Yeah, I think at this point, we don't have numbers with large amounts of pediatric patients yet. We will be collecting that data, and right now we do expect that children, whether they have IBD or other conditions, will have similar responses or side effects as well.
Great. You mentioned that they ran clinical trials and mentioned some statistics of the outcomes of those clinical trials. Are those trials ongoing, and are they continuing to happen for this age group or maybe other pediatric age groups, to your knowledge?
Yeah, so they're also studying this vaccine in younger patients. So currently, kids age 12 and older can receive the vaccine. And in younger patient, there is a Pfizer study for ages 2 years and onwards, and that will contain about 5,000 children nationwide, and that's already started, and the first dose has been given to those patients. Moderna also has a study, and that's looking at it at the use of their vaccine for children ages 6 months and older.
Wow, that's great. So speaking of our IBD community, there has been some concern that the effectiveness in the vaccines in patients who are taking certain immunosuppressants, that perhaps this isn't producing enough of the antibodies to fight off COVID-19. What do we know about this so far? What should caregivers think about as they're considering this vaccine for their children?
So that concern came about because with some other vaccines, it seems that IBD patients and those on certain medications may not have as robust an immune response to some vaccines, such as hepatitis B or pneumococcus, and thus, the question is, well, is this the same for a COVID-19 vaccine? And what we have seen and what we think at this point is that our IBD patients should have an immune response regardless of most of the medications that they're on. We at first were debating, going back and forth, whether we should space the vaccine with other medications. And at this point, we're saying that when you're eligible, get the vaccine. There were some reports that patients with IBD on anti-TNF therapy may have a reduced response to one vaccine. And other studies actually show that no, even after a single dose, they do have a robust immune response. At this point, we're saying get both doses. I think the one caveat that you'll want to talk to your own doctor about is if you're on prednisone, because that does suppress the immune response, and your doctor may talk about the ideal timing of the COVID-19 vaccination and possibly adjusting the dose of prednisone.
Great. So generally speaking, do you recommend that caregivers reach out to their pediatric gastroenterologist before scheduling the vaccine?
Yeah, I think if you have questions or concerns, it's always a good idea to reach out to your medical team. I think for the most part, in general, we are recommending that all of our IBD patients who are eligible receive the vaccine. Again, if you're on steroids, talk to your GI doctor. And if you have questions, please do direct that to your medical team. There may be some certain scenarios that you're facing or other things that are going on that you may have particular concerns with. But as a community, we feel that this is really safe and all of our patients with IBD should receive it.
Great. And what about children who perhaps have already had COVID-19? Should they also consider being vaccinated?
Yeah, so the CDC says that people should be offered the vaccine regardless of prior symptomatic or asymptomatic COVID infection. And we don't need to be testing for antibodies or status prior to giving the vaccine. So if a patient has had COVID-19 prior, we do want to ensure that they're recovered, they're not having any acute symptoms, and they're out of their isolation period. But we do recommend that patients, even if they've had COVID-19 prior, do get vaccinated with both doses of the vaccine. There is some thought that after having COVID-19, your body has this immunity that it's developed to further infection. However, we're not quite sure how long that lasts. We think maybe a few months, but it may be shorter. And so it is important that you do keep yourself protected.
Great. And you've mentioned a few times, you've referenced receiving both doses, which Pfizer is a 2-dose vaccine. Is there anything different about the pediatric vaccine from adults? So the dosing sounds similar. Is it very similar to what adults have experienced with the vaccine?
It is. So the dosing amount is actually the same as the adult, and as well as the dosing interval. So for the Pfizer vaccine, it's 3 weeks or 21 days in between doses.
Okay. And I know that there has been geographic, state-by-state variability with regard to scheduling. Do you anticipate any type of prioritization, such as when the adult approved vaccine rolled out, or what do you see on the horizon as far as getting scheduled for pediatric vaccinations?
So right now for children ages 12 and above, we are open everywhere for, there's no prioritization, so you don't have to have pre-existing conditions to receive it. It was opened for all patients, and it still is. I think when we were first offering it to adults, we didn't have the capability to give it out all at once. We just didn't have the volume of vaccines to be able to give it out to everyone. And thus there was that rollout or prioritization. However, we do seem to have the supply at this point, and we are at this point not prioritizing. So it is open to everyone 12 and over. And it remains to be seen how that will play out with the younger children, but I do suspect that it will be similar.
Great. And if my child is due for any other immunizations, is it safe and okay to receive the COVID-19 vaccine? Is there any particular guidance around how to coordinate with other immunizations that may be needed for a child?
Yeah, so at this point, we're saying yes. So you can get the vaccine with other vaccines. And we do this in commonplace with other vaccines, right? So we give multiple vaccines at the same time, and that seems to be safe and effective. And at this point, we're saying if you need the COVID vaccine and other vaccines, you do not need to separate them by a certain amount of time. You can get them at the same time. This is different. When it first came out, we weren't quite sure, but with experience, we're now seeing that it is safe and effective to receive them together.
Great. So we have heard throughout the pandemic that perhaps sometimes with children, they are less symptomatic, there are less concerns with COVID. Is there any reason why, given the lower positivity rates in children and some of those more asymptomatic ways of expressing COVID-19, that you might comment on why it's necessary for the pediatric population to consider the vaccine?
Yeah, so I think many people have the impression that COVID-19 is not that bad in children, which was somewhat of a false narrative, I think, at the beginning of the pandemic. While kids do overall much better than adults, the infection can be still quite dangerous to an individual child, and it's really hard to predict who will and will not do well. So studies have shown that about 10% of kids with COVID end up hospitalized, and that about a third of those patients may need to go to the ICU. And these high proportions compare to other infections that are commonly seen in children, like influenza. In teens, they do seem to be at higher risk for severe COVID-19, so MIS-C. And, at this point, of all cases of COVID, we're seeing over 22.5%, in the past few weeks that are positive in pediatric patients. So that's a larger percentage. And, we suspect that this is because many of the older population are now vaccinated, and we're seeing it more and more in children who are not vaccinated. So it's really important to know that even if a patient, even if children don't have as many symptoms, it doesn't seem to last as long, they are still at risk for serious complications, not only serious complications in the short term, but in the long term too, because we know of adult patients who get COVID and the quote unquote long haulers, And there may be something similar in pediatric patients. And there is this MISC, or multi-system inflammatory syndrome, which, can be scary and even life-threatening.
Wow. So essentially you're saying right now we're seeing an uptick because of many adults are vaccinated. So the proportion of positivity rates are really being directed toward that pediatric population until we get them vaccinated.
Right, right. And I think there's a lot of work and efforts in getting it approved and getting our kids vaccinated.
So that makes me eager for the opportunity for even younger kids to potentially receive the vaccine. And you mentioned that those trials are happening right now. Do you have any guess or any level of anticipation for when we might see approval for younger ages below age 12?
Yeah, so at this point, we're suspecting that around September, there may be an EUA granted, so approval for children 2 years and above. And that would be really exciting. And it may be step by step with younger kids like age 6 and above, and then the younger population. So, even at the end of the year, maybe even 6 months and above. So I think we'll see this rolling out process, hopefully in September, and it would be great if it was even earlier or right before school starts in the fall.
Yes, that's very exciting news to hear. In an abundance of caution, you were actually part of a decision-making process around our Camp Oasis program this year. We really vetted the science available and ultimately decided that it would be safest for kids to host a virtual camp experience this year. I know that camp is near and dear to you, Dr. Singh. You're a very important volunteer in Washington State and for our camp community across the country. What do you see as the benefits for kids for participating in our virtual camp program? We know it looks a little different, but what are the benefits of that virtual camp experience?
Yeah, so, as you said, Becky, it was such a hard decision, and you had a lot of great minds thinking about how best and how safest with the information that was available at that time to plan for the summer. And camp is going to be virtual this year, and I think there are so many benefits for our kids, our patients to be attending camp. I think the campers are going to have such a great time. There's been a lot of effort, and I know some of that background, and I gave you a lot of the credit for that, for making sure that it's a great program. There's such a benefit in connecting with other kids with IBD, and it's whether or not you talk about your IBD, it's just nice to know that you have a community, that there's other kids just like you, just like your children who have had potentially similar experiences and have some of the same thoughts and concerns and hopes for the future. So I think there is such a value in that community. And camp this year will be grouped by ages. So I think that's really exciting. So they'll be not only with their community, but with their peer group. And there's a lot of really exciting functions. I don't want to give all of it away. I think there may be some secrets, but I've been telling my patients that there's some really exciting programs that are being planned. So I think all of that, just being with the community, being with your peer group, having those experiences together. And it would be really fun if, the next year we're planning in person, we'd hope to be in person, that you'd actually get to see your friends in person after having that virtual camp experience. And regardless of the weather, it's going to go on.
That's a great point. Thank you so much for that enthusiastic response. The camp team really is planning a very interactive and fun experience for our campers this summer. We are still taking registrations. We will be taking registrations through the middle of June. This is a great opportunity, especially for families who haven't explored Camp Oasis before, or if your child is more recently diagnosed, we'd love to welcome you to become a part of the Camp Oasis community by joining our virtual program this year. Every camper will receive a box of materials that are unique to each age group, as Dr. Singh mentioned. And so we really have some exciting things in store for these campers, and we would welcome anyone on this Facebook Live tonight to consider registering their children for Camp Oasis if you haven't done so already. There's still time, and we'd love to see you there. And we also offer opportunities to talk with and chat with and interact with pediatric GIs like Dr. Singh, who are available to answer questions and be there to support our kids until we can get back to residential camp. So thank you so much for sharing that. Is there anything else, Dr. Singh, some final thoughts that you would like to share with the community on Facebook tonight?
Yeah, I do want to acknowledge that this past year has been so difficult. We all really want to get back to the sense of normalcy that we had before the pandemic. It's been a very long year, over a year. And, it's important to acknowledge that the pediatric population has in particularly suffered a lot at the hands of this virus, particularly when we consider all the school closures and the impacts to their daily lives. So making sure that your kids can get the COVID-19 vaccine as soon as they are eligible is perhaps the most important step that we can take to fighting this new normal again, and our children deserve that.
That's so true. And thank you, Dr. Singh, for being one of those heroes that worked throughout this pandemic to be that familiar face to kids and to ensure that they stayed healthy throughout the pandemic. We couldn't have done it without our healthcare providers who stayed the course through this. We really hope that tonight's chat answered all of the questions that you might have had, or many of the questions about the COVID-19 vaccine in the pediatric population. We're going to continue to update our foundation website and continue to provide resources so that you can stay up to date on the latest and greatest. Vaccine information and other opportunities are on our website at www.crohnscolitisfoundation.org/coronavirus. You will find a wealth of resources there. I want to give another big thanks to Dr. Singh for joining us for tonight's chat. And again, thank you for all you do to care for our pediatric IBD patients. You're a great support for our families and for our pediatric community, and we're so appreciative of you, and we're so fortunate for your partnership with us.
Thank you. It's such a pleasure.
Thank you. If anybody has questions that were not answered, I once again want to remind you and encourage you to please contact our IBD Help Center. Again, that's at info@crohnscolitisfoundation.org, or you can call them at 888-MY-GUT-PAIN. Thank you all so much for joining us tonight. We hope you learned something this evening, and we hope that you have a great night.